How can you evaluate the level of knowledge if people that you're working on with have mental disabilities? If you're also talking about mental disabilities and you want to develop, let's say, the knowledge about people with mental disability or some other type of disability, so how can you evaluate if people will really remember the kind of knowledge that you give them if they have some type of disability?
So chances are, if somebody has an intellectual disability, they have a caregiver, and often someone else is brushing their teeth for them and making their dental appointments for them. So you can evaluate the knowledge of that person. So it may be if they live in a setting where there are paid caregivers, you can go in and train the paid caregivers and evaluate their level of knowledge and their understanding of the importance. However, I have done a lot of work in conjunction. So I used to do a lot of work where we would bring people in and we would teach the people, the adults with the intellectual disability, and we would evaluate them as far as ask them, because a lot were able to give feedback. But then we also trained their caregivers, and we did an evaluation on their caregivers as to what they had learned. Were they going to implement that in practice? Now, mid and longer term, then you start looking in people's mouths and you see, is this working? But when you go in and do a one-time education project, you're probably not going to be able to follow long-term and check the rate of dental caries. But there are always ways to evaluate. Sometimes you have to be more creative. And I'm happy if anybody has any questions about a specific project, I'm really happy to talk to them about how to evaluate it. Because when you do your poster presentation, if you're submitting a poster presentation at the end, you do have to have, some type of evaluation results in that.